Have you just been diagnosed with iron deficiency anemia in your pregnancy? Anemia in pregnancy is such a common issue that I actually created this document right here for my clients. And if you'd like a link to that, I'm going to go ahead and post it in the description below so that you can see the information I give my midwifery clients on how to treat anemia naturally. Hey mamas, it's your Cajun Stork here, Midwife Kyra. I believe in truly natural birth because I know it makes for better birth experiences. Consider subscribing to my channel and joining in today's conversation about iron deficiency anemia in pregnancy. Anemia is a medical condition during pregnancy in which there's not enough red blood cells to carry oxygen throughout your body. This is especially important during pregnancy when you're growing a baby and expanding your blood volume to prepare for the blood loss that's going to come in birth. Iron is a mineral found in red blood cells that is stored in the muscles that helps to carry oxygen to the rest of the body. When you don't have enough iron in your red blood cells, you are going to feel fatigued, you're going to feel headachy and weak. Shortness of breath is very common when you have anemia. And also, in addition to that, what a lot of people don't realize is when you're anemic, you also have a resistance to infection, which means you're more likely to get an infection not only during your pregnancy, but in the postpartum. And so it's really important that you get your iron levels back up to a normal state before you go into labor. But if you start to go into having cravings for like non-food items, which I know that sounds really weird, but like if you start craving things like dirt or laundry detergent, that's definitely something you want to call your healthcare provider about immediately, as this can be a really definitive sign of anemia and something that we want to follow up on and get you supplemented appropriately. Anemia is especially a concern during pregnancy because it's not only related to low birth weight, but can also lead to a premature birth. In my practice, I start with foods first. And so we start with green leafy vegetables, nuts and seeds. I recommend that my clients do a lot like a high protein diet to kind of boost their calorie intake and their protein intake during this time so we can work on building our blood supply. In addition to that, we really want to do other foods like oatmeal, for example, or beans. You can actually soak these foods overnight, rinse out the water, and when you go to eat them after you cook them, you increase your iron absorption tremendously. In fact, I've heard something as much as 800%. So it's really important that you guys take these things seriously and you eat things like nuts and seeds. I'm a huge fan of peanut butter and jelly, believe it or not, during pregnancy because it can be a huge, simple way to get in iron-rich foods during your pregnancy. Now, if you are a vegetarian or a vegan and you just found out you're anemic, it's especially important that you tell your healthcare provider and possibly even consider seeing a nutritionist or a dietitian, because vegetarians and vegans have some special dietary circumstances that will require additional supplements to help them deal with anemia. For the rest of us, foods typically can make a huge benefit, but when food's not enough, it's really important that you consider some iron supplements. And as a midwife, as you can imagine, I prefer natural iron supplements. Why? Well, one of the biggest things and complaints about iron supplements is that they cause constipation. Now, I recommend an iron supplement called Floradex. In my personal practice, I have seen Floradex simply be enough to boost iron levels during pregnancy. It's recommended that you take it twice a day on an empty stomach. And Floradex is a natural iron deficiency anemia solution that not only boosts your iron levels, but has no side effects of constipation, which is a huge benefit to you when you're pregnant. In addition to that, many practitioners will recommend over-the-counter supplements such as this supplement right here called Slow FE. Now, this supplement does have a risk of constipation, in which case you might want to consider this supplement called Farragon. Both of them are great. You can buy them at CVS or Walgreens, but again, if you're looking for something more natural, Floradex is definitely a go-to during pregnancy. If you want to take your iron deficiency anemia treatments a little bit further, another recommendation that I love during pregnancy is called chlorophyll. Chlorophyll is a cheat way to get in a green leafy vegetable during your pregnancy. And chlorophyll, this drink right here, it has like a mint flavor. So you can actually sip on it all day, which boosts your hydration and also boosts your vitamin K levels along with your iron. Now I'm gonna go ahead and post a link to all of these items in the description below so that you guys can have access to them. But these are recommendations that I give to my clients personally in my practice here at the Natural Birth House. Now, if you guys follow my videos every Midwife Monday, you know that I'm a huge proponent of red raspberry leaf tea. One thing you need to know when you're anemic is that you should not be drinking my recommended red raspberry leaf tea along with your iron supplements, as the calcium in red raspberry leaf can actually block you from absorbing the iron in your Floradex. So let us know if you've ever had anemia. If you have, click the like button right here on the screen. I want to know how many of us suffer from anemia during pregnancy, because like I said, it's super common. And if you have any questions or supplement recommendations, I'd love to hear from you. So post them in the comments below. Otherwise, I'll see you guys next Midwife Monday. Thanks for watching. Bye-bye.